Most dogs have lifestyles that are very different from what nature intended them to be. Confinement to kennels and small backyards do not allow many dogs to get adequate exercise that stretches the muscles of the abdomen and back. Performance dogs are prone to subluxations due to the high physical demands that are placed on them during competition. Something as minor as holding a tennis ball to one side of the mouth instead of in the middle may change the way that a dog's entire spinal column moves and reacts to the environment. Age can lead to problems in the spine. The intervertebral disc undergoes degenerative changes as the cartilage ages. The ability of the nucleus to maintain water content and handle stress decreases, causing a decrease in the biomechanical function and increase in small tears and scar tissue adhesions. These can lead to problems with motion in the affected joint. Overweight animals will cause undue stress to the joints of the legs and spine as they move around. The stress can lead to subluxations and multiple health problems for the pet. The most important thing for the future health of the pet is to have these subluxations corrected as soon as possible. Activities that cause subluxations may also need to be modified to help prevent further occurrences. When in motion, dogs require the use of almost every bone, every ligament, and every muscle in their body to complete one stride. In the normal canine gait, the head should be carried level, not tilted to one side. Biomechanics of the spine will vary when a dog is carrying something in his mouth. Motion generated at the rear of an animal travels fluidly to the front like a wave in a rope. The bones and muscles of the back flex and extend, allowing elongation of the stride, increasing power. Pelvic limbs are the motors of locomotion that drive the trunk forward. They have osseous or bony articulations with the axial skeleton through the sacroiliac joint and have musculature capable of simultaneously extending the hip, stifle, and hock. The vertebrae should move in three ways: dorsal and ventral flexion, left and right lateral bending, and axial rotation. A competent veterinary chiropractor can examine a dog's spine to determine if there are any subluxations present and their degree of severity. Prior to such an examination, there are a few exercises that may give some indication as to whether or not a dog might benefit from chiropractic care. While holding a treat near the dog's shoulder, pay attention to its movements as it attempts to reach the treat. There should be no tilt in the head as the dog turns to reach back. Many dogs will back up in order to try and get a treat. Others will twist their head around and grab the treat with a sideways maneuver. Observe the amount of flexion displayed and the readiness of the dog to bend its neck as opposed to repositioning its torso. You can also check the length of the dog's back legs. They should be the same length when the dog's spine is straight as they are when their head is turned from side to side. Subluxations in the head, neck, or pelvis may cause one leg to appear shorter than the other. Look for heat, swelling, and tenderness along the spine and surrounding areas. The dog may benefit from chiropractic care if he or she exhibits one or more of the following signs: decreased levels of performance, loss of wind or endurance. Rib subluxation will affect the dog's ability to respire. Problems or difficulty executing desired movements such as climbing stairs, jumping on the couch, or negotiating agility obstacles. Behavioral changes such as starting to snap or refusal to play with family members. Problems eating or refusing to play with toys. Short striding, uneven strides, nail dragging or stumbling. Diagnosed conditions such as degenerative arthritis. Muscle imbalance, spasms or atrophy. Abnormal posture when standing, standing with hips uneven, choosing to stand on uneven ground, not squaring up when urinating, or holding tail to one side. Shaking of the head, constant ear problems or allergies. Injuries resulting from falls, training, or other activities. Stressful situations such as poor conformation of the dog. Chronic disease conditions, multiple repetitive infections, or weak immune system. Your patients might benefit from chiropractic care if you observe any of the previously described signs. Expanding the medical care you offer to include chiropractic services or referrals may not be for every hospital, but having a better understanding is helpful for any client that inquires about chiropractic care for their pet. To learn more about animal chiropractic care or to find a certified doctor near you, go to www.avcadoctors.com or call the AVCA at 918-784-2231.